Hello everyone, welcome back to Medical TubeMate. Today we are going to see place of service POS in medical coding and billing. Very important topic like in each and every claim required place of service code. Who is working in medical coding and billing, they should know what is place of service. So each and every claim required place of service code. So in this chapter we are going to see what are the place of services and codes. So what is place of service? POS. A place of service code are two-digit numerical codes employed in medical coding to identify the practice where area where the service has been rendered by the physician to the patient. So basically place of service place where service has been rendered. Each POS code refer to a distinct type of service setting ranging from doctor practice to a hospital, an outpatient clinic or patient residence, emergency department, urgent care, etc. So it is necessary to mention place of service on professional claim form. Without it, claim cannot be released. So it is very important whenever we are submitting the claim to the insurance, then the place of service should be mentioned over there. Without place of service code, claim cannot be submit to the insurance. If we are submitting, then definitely the claim will be rejected or denied. So, place of service is very important, and CMS has designated a complete code list of place of service, which is standard across US healthcare process. So, CMS has designated, and CMS always release the place of service code addition and deletion. So, we have to follow that updation. So place of service is very important, and today in the next slide I will show you some common place of service codes and place of services. And also I will show you the claim form where place of service we are adding. And if we are coding into the software, then definitely every software having place of service claim box where we have to add place of service code. So we will see in last slide, and I will show you claim form also. So common place of service codes. So here you can see the place of service codes and descriptions. So I have selected few commonly used place of service codes for explanation, and later on I will show you the whole list of place of service. So common place of service we are using in frequently. So POS 11. 11 is for office visit. You can say description here. Office used for service provided in physician office. So physician office for any service is rendered in physician clinic office, then place of service will be 11. So for office we have separate code set also. I will show you here. This is office and other outpatient service codes. So these are the code set 99202 to 99205. This is for new patient, and for established 99211 to 99215. This is for established patient. So whenever we are coding this code set, then the service will be provided in office only. So in this case, place of service will be 11. So like that we have to think. So POS 12 is for home. Any private residence other than the healthcare facility where the patient received care service. So this is home only. So at that time we have to add place of service code 12. Like that, inpatient hospital use when the patient is admitted. When patient is admitted to the hospital, then that claim will be having place of service code 21. So as you know, the inpatient code sets are different. Hospital inpatient and observation care service, these are the code sets for inpatient ENM. So here you can see 99221 to 99223 is for initial hospital, inpatient or observation care, and then next code set for subsequent hospital inpatient observation care. Like that, you will see hospital inpatient and observation care including admission or discharge service, and hospital inpatient and observation discharge service. So whenever we are billing ENM from this code set, that means patient is admitted. The place of service will be 21. So like that we have to think. Whenever we are billing, that place of service will be very accurate. Otherwise, the claim will be denied. And then next is place of service 22 on campus outpatient hospital. A section of the hospital main campus is dedicated to the treating sick or injured patient who don't need to be hospitalized or institutionalized. This area offer diagnostic, therapeutic and non-surgical treatment, providing treatment for sick or injured patient without hospitalization. So next place of service is 23, and this is for emergency room. We are commonly calling as ED department or ER room. Portion of the hospital where emergency health condition, injury and illness are diagnosed and treated. Whenever we are submitting ED claim, then the place of service will be 23. And for emergency department also having specific code set in ENM, show you that one also. So emergency department service, here you can see 99281 to 99285, new or established patient. So either for new and established, the code set will be same. So this is the ENM code set for emergency department service. So whenever we are billing for emergency department, then the place of service will be 23. So like that, ASC ambulatory surgical center used for outpatient surgeries. So the POS will be 24. So like that, for urgent care, POS will be 20. Urgent care facility used for the service at an urgent care center. And then next is SNF. The place of service will be 31. SNF means skilled nursing facility for long-term care service. So next place of service is telehealth, which is very important. Nowadays we are getting so many claims from telehealth. So telehealth claim will have place of service 02 and 10. After pandemic COVID, the huge number of claims we are getting for telehealth department, where service is provided through telecommunication technology, audio and video. Here we have two place of services. One is 02 telehealth provided in other than the patient home, the location where care service are provided through telecommunication technology. However, the patient is not in their home while receiving this service. And then place of service 10 is telehealth provided in patient's home, the location where the care service provided through telecommunication technology. However, the patient is at their home while receiving this service. So we have to review the medical record appropriately. Telehealth service provided and patient location is home, then place of service will be 10. And other than patient home means place of service will be 02. So this is very important. So whenever we are billing for telehealth, then place of service will be 02 and 10. Telehealth code set where you will find 9800 to 98007. This is synchronous audio and video evaluation and management service. And then next code is for 98008 to 98015. This is synchronous audio only ENM service. So the above you will see audio and video. The next code set is only for audio. 98016 is brief synchronous telecommunication technology evaluation and management service virtual check-in. So whenever we are billing the code from this code set, that means this is telemedicine evaluation and management service. Then place of service will be either 02 or 10. And then next I will show you, this is the snapshot of claim form. So whenever we are submitting claim to the insurance, then we have to file the claim form, and this is the half portion of the claim form where you will find the CPT codes like 99213878880J110099051. So here you will see the B column where 11 11 11 11. So 11 is place of service. So like that we have to add. Without place of service, claim will not be released and will not be submitted to the insurance. So this is very important. So I hope you guys clear what is place of service and how to add. So I hope you guys understood this chapter place of service, and if you like, then please like, share and subscribe Medical Tube Med.